My name is Walter Rose. I'm a general and laparoscopic and robotic surgeon at CHI Memorial Hospital. My particular problem was diverticulitis of the sigmoid colon, which is the lower colon, and it's quite common in our population, especially as we age. And because I was very familiar with diverticular disease and all of its manifestations, when I had some of the symptoms the typical patient would have, I immediately knew the diagnosis.
Dr. Rose had something called a colovesical fistula related to diverticulitis. Diverticulitis is when you have a weakening in the colon and you form a pouch, and that pouch can get infected and can burst.
I knew a couple excellent surgeons that I was able to discuss with, and they could set me up pretty early for surgery.
Operating on one of my colleagues and really my boss was a little bit intimidating. We come to care for all of our patients, although we usually just get to know them in the clinic, but operating on someone that you've known for a long time, who also happens to be your boss, is a little bit different.
And so Dr. Wilkes and I spent a lot of time prior to the surgery looking at the CT scans, and we knew very well what we were going to go into when we got into the surgery.
I'm fortunate to have younger associates in the practice, both of Dr. Wilkes and Shah, who are fellowship trained. So they're very innovative and forward-thinking in terms of minimally invasive surgery, and especially the robotic platform, because that's what the future of surgery is going to be in their career.
Robotic surgery is the way that surgery is moving across the country. If you look at all the major academic centers, the best hospitals in the country and in the world, robotic surgery has become the standard of care.
Doing that surgery open would have required a pretty large incision, a lot of abdominal pain, prolonged time in the hospital, recovering particularly with the pain. And frankly, we were able to get him out of the hospital very quickly with a very uneventful recovery.
I think I had a greater appreciation for what the patient would experience. I also had a greater appreciation for what my surgical options might be. And I was certainly invested in the robotic platform because I've seen it. It's such an innovative thing in the field of general surgery when you go from large incisions and lengthy stays to small incisions and 1 or 2 night stays.